Hey guys, welcome back to CardioVisual for another episode of CV Health Talks. Today we are going to be talking about valve disease. Today our guests include Lindsay Clark from the Alliance for Aging Research and Dr. Allison Ali, an interventional cardiologist. Today we're raising awareness for Valve Disease Day hosted by the Alliance on February 22nd, so a little build up for that. And we hope to save lives and empower patients by educating on valve disease, its symptoms, and management. So Lindsay, I'm going to hand this off to you. What is Valve Disease Day? Can you give our audience a little background?
Of course. And Shannon, thanks so much for having me on to talk about Valve Disease Day. Valve Disease Day takes place every February 22nd, so during American Heart Month. And it was started by my organization, the Alliance for Aging Research, when it became really increasingly apparent to us and a lot of others in the space that people don't know what valve disease is. This is despite the fact that it impacts as many as 11 million Americans. We actually did a survey and found that 3 out of 4 people don't know little to nothing about valve disease. So the majority of people don't know what valve disease is. And so the seriousness of the disease, combined with the fact that symptoms can be difficult to detect, they're often dismissed as a normal part of aging, which it isn't, makes this lack of awareness particularly dangerous. So we want to encourage people to understand that heart valve disease can usually be successfully treated in patients of all ages if it's treated in time. So this makes this education and awareness effort particularly important. So we started the Heart Valve Disease Awareness Day campaign so that people will better understand the risk factors, the symptoms, we can improve detection and treatment, and ultimately save lives. So on February 22nd and throughout the year, we're joined by about 100 organizations. It's professional societies, nonprofits, advocacy organizations, foundations, hospitals, and heart centers who all come together on this day and throughout the year to help spread common messaging about valve disease. We're also joined by thousands of advocates. So it's the patients, the caregivers, the clinicians, the people who've been touched by valve disease or seen people touched by valve disease to help spread the message about how important it is that we listen to our hearts and we understand our risk factors and symptoms. So they're all engaging on February 22nd. I'd encourage all of your listeners to engage as well. They can go to valvediseaseday.org to learn more. They can take the Listen to Your Heart pledge, join our Twitter chat on February 22nd, and tune into our virtual conference that day. So thanks, Shannon.
Of course. Thank you so much for joining us, Lindsay. And
Absolutely.
Lindsay and I thought, how can we better spread awareness? And we thought, why not bring Dr. Ali on to give you guys an educational session? And doctors, you can send this to your patients, or if you're a patient on here watching, you can send this to your friends, your family. So Lindsay, thank you again for joining us. And we're going to move on to our Q&A session now. So just to give you guys a little background on Dr. Allison Ali, he's an interventional cardiologist who's trained in both Philly and the Mayo Clinic. He's been in practice for the last 10 years, and his specialties include valvular heart interventions and heart valve research. So first, do you mind just explaining what is heart valve disease for those who don't know?
Yeah, thanks, Shannon, and thanks for the kind invitation. Heart valve disease is a disorder of one of the four, or one or more of the 4 heart valves in the heart. It could be that the valve is leaky, or what we call regurgitation, or it could be narrow, what we call stenosis. Basically, the valve does not function as normal.
What are the symptoms of heart valve disease?
The symptoms of heart valve disease will include shortness of breath, swelling of the feet, fatigue, sometimes just generalized weakness, and sometimes they are difficult to identify as being valvular in etiology, because most patients will have these symptoms from other conditions. So one has to be astute when we're looking at our patients when they come to us with these symptoms to make sure that they are not from a valvular problem.
What can cause valve disease?
Well, there are a variety of causes. Some is congenital. Some people are born with a heart valve problem. For a long time, it was rheumatic. People that had rheumatic infection as a child may later in life develop heart valve problems. Sometimes just aging. A most common form of heart valve disease is called a senile aortic stenosis, which as we get older, we get calcium on the valves, and the valve can narrow. Sometimes it's a combination of infections, endocarditis. Sometimes it's a coronary artery disease. Somebody has a myocardial infarction that affects the heart muscle, may end up affecting the heart valve. And sometimes we don't know. Some medications might cause heart valve disease. Sometimes we've had people that have had radiation therapy for breast cancer, other cancers. They may end up with valvular problems later in life. So as we do life-saving therapies for other conditions, they may end up, over time having unwanted effects on the heart valves.
What are the risk factors for heart valve disease?
Risk factors include diabetes, high cholesterol, high blood pressure, the traditional risk factors. Obviously, aging can be a risk factor. The older we get, the more likely we are to get heart valve problems. So those are the more common risk factors.
The research shows that African Americans develop valve disease at younger ages. Can you speak a little bit to that?
Yes, we've seen that African Americans would tend to have more significant heart valve disease at a younger age for several reasons. A lot of African Americans have these traditional risk factors that may lead to development of heart valve problems, high blood pressure, diabetes, high cholesterol, renal problems. If you're on dialysis, you may end up having a valvular problem because of calcium. The other thing is that African Americans tend to have a shorter life expectancy compared to Caucasian Americans. So most times, we see these heart problems in a younger population of African Americans. All those, and then the socioeconomic factors does not help. Lack of access to healthcare, insurance issues. Those things may cause problems and lead to late detection of heart valve problems. Things that could have been corrected with medicines. If patients are not seen on time, that can be a problem later in life.
And what other disparities exist, let's say with other populations as well? Are there any?
Yeah, I mean, there's a wide variety of disparities, I think in African Americans and non-African Americans, Hispanics, even American Indians, that, there's a socioeconomic issue, access to care. Then there's the mistrust or distrust of the healthcare system. There's a delay in decision making. There's a lack of access to, programs or hospitals that may help care for the patients. Education gaps, economic gaps. All those things lead to either delay in treatment or misdiagnosis or lack of treatment at all. Patients may never get to see us, and they may suffer for years and years with the heart valve problems.
What options are available for valve disease?
Yeah, there's several. I think the underlying foundational treatment is always medications. It's not everything that we have to operate on or do something for. Simple things like controlling blood pressure, controlling diabetes, controlling cholesterol, exercise and diet. A lot of times this can help stave off significant heart valve problems. Now, if the patient goes along and develops, a significant heart valve problem, then the options become either surgery, which can be an open operation to replace or repair the heart valve, or but more commonly nowadays, we have what we call transcatheter options, less invasive options, where we can go through the groin and repair or replace the valve with minimal impact on the patient. So there's a variety of options to treatment of heart valve disease, from medicines to surgical therapy to what are called transcatheter or less invasive therapies.
What could happen if we leave valve disease untreated?
Yeah, there are several complications. Number one is the development of heart failure, where patients cannot breathe, they are swollen, they have a lot of fluid buildup, they can't really do most of their daily activities, they're really miserable. The valve may end up affecting the heart. Then patients may die from this. There's a lot of people that have died from untreated heart valve disease. So it's this progression of going into heart failure, which is usually the most common endpoint. And from there, it can affect the kidneys, the lungs, and ultimately it may lead to a loss of life.
At what point should patients say to themselves, man, I should really go see a doctor?
Well, if a patient has any symptoms or they're concerned that they may have an underlying heart valve disease or the condition, they should talk to their primary care doctor, who can do some tests, including an ultrasound of their heart, or refer them to a cardiologist. I don't think anybody should delay care for this condition, because these are really treatable conditions, and nobody should die from untreated heart valve condition. I think that a diagnosis is made by listening to the patient's heart and doing an ultrasound to figure out what the issue is. And then there could be different therapies, like we talked about, medicines or even surgery or less invasive options. So we should encourage everybody to please talk to their doctors, rule out a major heart valve condition as part of the routine medical care.
And last but not least, why is increased awareness for valve disease so important?
Yeah, thank you. That's a great question, Shannon. You know, for years and years, the focus on cardiovascular disease has been not only heart valve, but a lot of it has been coronary disease. You know, most patients know about heart attacks, they know about strokes, they know about heart failure. Even though heart valve conditions have always been there, but it has not been as popular, I must say, as the other problems that affect the heart. And we specialize in this have recognized that this is a major component of morbidity and mortality amongst our patients. And we have to spread the word. We have to continue to educate people on heart valve conditions for several reasons. Number one, these are common conditions that can be easily treated. And number two, if left untreated, they can cause harm and lead to loss of life. And number three, they are widespread and we have really good options and tools for treating our patients. So education and awareness is critical. Heart valve disease should just be as common as breast cancer or as coronary or heart attacks and strokes. It's very, very important that we continue to educate the general populace about these conditions.